Everybody, hopefully you and welcome to Tuesday night spinal workshop at Monarch Family Chiropractic. I'm Dr. Kristen. We're going to go into foam rolling today. We're going to talk about the benefits. We're going to talk about why do we roll, where do we roll, how do we roll, and different tools to use that are helpful for different types of rolling or a different body type, or possibly an injured or trauma area, or place that there's a lot of adhesions and we want to be really sensitive around that area. Doesn't mean you can't do some of these supportive tools. It just may be different in how you do them or the type of tool you use. So thank you for hanging out with us to start a little bit later today, because we have a busy office with one doc and not two of us. So we're going to jump right in. Now, we've done foam rolling workshops. There are 2 other spinal workshops recorded and on our YouTube channel. So I'm not going to go into every detail that we did in the other ones, or some of the links that you have access to or that we have posted are on previous workshops. We wanted to keep this one, in a sense, down and dirty and about the movements and about me demonstrating some of those so that you could see how to do and then be able to watch this and come to us with questions and already have an idea of, oh, I saw you do this for this area, or I'm having issues here. Could that be something that supports it? And when you have a better frame of reference of what we're doing and where we're doing it, then it's going to be easier to direct you with, yes, do this, not this, or no, we don't want you doing that on that area of your body yet, that type of thing. So I know that there is more detail. If you want to see diagrams, pictures, muscle groups, web links, that's all on previous workshops on foam rolling. I think it was April of last year and then one since then. So you can search our YouTube channel for foam rolling, and a lot of those fall under the spinal hygiene section, and you'll be able to find them easily and reference those there. So we're going to jump right in. Why we foam roll is that we're looking at more of a fascia layer that's going on that connects the muscle groups. So we tend to roll on muscles, and that can help with breaking up adhesions, but there's a lot of tone difference and connective difference where a muscle on either end meets the tendon or the ligament, and that is what attaches to the bone on either end, right? So there's areas where we may get adhesions in muscle groups because things have injury, things have repetitive, stress to them or motions. But the fascia layer is really what is the interwoven connective pieces of everything as it works for our body. And if it's working against us or we're doing a stretch, most often people tell me they're stretching, but they don't feel an effect from it, or they don't feel the same relief from it, or it just doesn't feel like it's doing anything anymore. There's connective tissue layers or fascia layers that need to be released. And many times there is things kind of within the muscle, but it's also more so at the connecting points. So that would be a big reason to add foam rolling to your self-care regimen, is that there's areas to get to that can help with stretching, and then helping almost bridge the gap between when you're going for massage work and they're getting through layers of things and releasing those adhesions, or trying to open up some of those fascia points of restriction and using the foam roller in between that. So I like doing that. That's one of my favorite things to do in between my right now, I'd say every 4-5 week massage. If that's more regular for you, then you may not feel like this is as necessary. But again, it's working different things than a massage therapist working more muscle groups and muscle bellies and trigger points. So when we go into, why we may do that, and the benefits of, we're looking at breaking up the adhesions, but really the big goal is, well, why? We want more functionality and mobility. So the body is multiple layers, multiple components. And so it's not just a muscle component. It's the fascia that connects, everything. And so we have a couple different tools here. They're the ones I suggest the most. There's not only one right thing, and there's probably things we won't even touch here that you could see or buy on the market. But I feel like we're going to go over basics and what I feel like works for most people, definitely at the beginner level. Even if you're not a beginner exerciser or things like that in a regimen, if this is new to you, start slow, start simple, and then you can always add either more advanced moves in or more foam rollers that have knobs on them, or kind of take it the next level. So I'd rather you do, with foam rolling, to me, less is more. Some people say, well, I already stretch, 15 minutes a day, 20 minutes a day. Now I got to add another thing. What I find is that when I'm not yapping, I can do my whole body. So we're going to take a few minutes more to show you things, but I can do my whole body foam rolling in under 5 minutes. So this is one that I may trade off what I do stretching on a foam roller day and not have to do as much, or just stretch certain muscle groups and then end with my rolling. So when we go into different components, it's, again, you may not do your full regimen every day. A foam roller is something that you may do every couple days to check in on something. But most of the time, once you've been using them enough, I'll get on once a week, if that. Sometimes it's less. And depending on, again, what I'm actively doing or not doing, and I'm able to keep up on it. So I think one thing Doc and I say a lot is that the frequency of your care, or the frequency of what you do, is really driven by the intensity of your lifestyle, right? Or what you're doing outside of work, exercise, activity, stress levels, mental, physical, emotional, all those components. So if a lifestyle is more intense, you may add more of these things in, right, to keep up with that. If it isn't, or I just would use it from the example of somebody who's training for something and training intensely, and someone who is not, is the average person who maybe does a couple days of exercise a week, or, our walkers versus our marathoners and triathletes right now that are training for things, different levels of activity, different levels of stressing the system and their bodies to perform. So it's not that this is I really stress that foam rolling, most people can do some version of, but again, there's different levels of intensity and what you would do and not do on it. And then how often you would do it based on what you're doing and how much you're stressing your system, your musculoskeletal system. So if we go into different body types or different areas before I start doing some of the motions, I would say that for simplicity of what you could do with, I think, the most body parts would be something like a foam roller that's skinnier, less diameter than the thicker ones like this. And again, there's not a right or wrong, it's just different in what you can do on it. And I would prefer someone to have a longer one than a shorter one. So these are like 20, 25 bucks for us to get. If you want to go spend 50 or 60 and go to a chain store where they've got it dyed purple and there's a Nike swoosh or something on it, or a yoga symbol, you're paying for the marketing and you're paying for the markup. It's foam. So there are different types of foam, but to simplify it, it's foam. So there are different ones that, again, you can go crazy with these. Something like this foam roller is kind of the bridging of the gap here, but with the knobs on it, it's just a little more intense. So I have one like this at home. I tend to stick on the flat one. So if I was, like I said, whether you're beginner or not to things, if you're a beginner to foam rolling, start easier. Start with something with a soft surface or a flat surface versus a knobby surface. But again, you'll get into trigger points and find some things you didn't know existed with something firm or something firmer and something with the knobs. I also am a fan of this one just because all body types and sizes are different. So someone who is smaller width-wise, this gets into places easier to me. If you're broader, that's okay, this will still work. But if you're, again, short versus tall versus in between, I feel like I'm an average height. But somebody shorter, this is still too short to do a lot of things on. This size, there's not many people that couldn't lay their head on one end and their bottom on the other end. So it's not that you're, if you're 6'5", but you're all leg, well, that's okay. This will still work because your head to your torso will probably still fit on this. If it was, based on your complete height, then yes, a lot of things might be too short for somebody that tall. And so if there's those of you, that I'm thinking of on the call that I know we talked about even today being on here, that maybe, 5'2" to 5'5", but, some of our gentlemen that are 6 to 6'5", that's okay. I would still go with something this length. This is 3 foot, so this is 36 inches and 4-inch diameter. The 6-inch diameter, if you're a smaller frame or you're not very broad, this gets into those shoulder blades really nice, and something thicker just doesn't get into the zone as easy because it's just got a wider diameter to roll over. So I like this size if you were going to pick one size and one thing to get. Another one that I'll demonstrate, so I'm going to talk through them, and then when I get on the ground and on the floor, that way you already know what I'm doing and what I'm talking about, is what's called the chirp wheel. So this is the plexus wheel that is really nice for specific to the spine. So your muscles are going on either side of the spine, those erector muscles. And again, if you watch the other workshops, we go through muscle groups and show a lot of pictures. So if you're a visual person or you like to know what muscles attach where and some of the terms I'm using, go to the other workshop and look at the slides that we go through the muscle groups on. This, I'm going to just kind of go past that and go through a lot of the motions more. So there's more workshop to watch demonstration of. So your spine sits right in the middle. So your spinous process is that center of the spine that is the bony part you feel, right? So this part right down the center. What we want the sides to be on is the muscles attaching to the spine, right? So on the right and on the left. So this is beautiful because it supports you not putting pressure right on the spinous itself. The spine gets to sit in this groove, but all those muscles attaching to either side of it and in between get to hit the roller part. So that divot, if you can see that, is there for a reason, and it's designed really more for the spine itself. So when I demonstrate that, there are 3 sizes, I believe, plus they've added some new tools this past year. This is something you could find on Amazon. And if you can see the inside of that, it is literally called the Chirp, CHIRP. No, can't see that. Okay. Same thing. I don't know what you can Amazon one of these, but I mean, you want a round, not a half circle. I would do 4-inch diameter by 36 inches, 4 by 36. We always have them here, these. So if you need them, they're in the office. These you just would purchase online. You can buy them individually, or you can get the set of the 3 sizes. Plus, I think, again, a couple of these new attachments with the smaller balls to do for trigger points or for like your feet in like a package deal. You're probably going to spend between $40 and $150, depending on how much of them you buy or how much of the different wheels you buy. I find that this mid-size, this is the mid range, is the most beneficial for all sizes and structures. So when I get on it, you'll see what it looks like. But if you're a much bigger framed person, you might like the large one that's size up from this. The smallest one is very specific, and it's not what I would even show you what to do with the kind of muscles we want to support you rolling. So the smaller one, even if you're a frame smaller than me, I would still use the mid-size. Lastly, when we get into things we haven't necessarily shown you, people ask me all the time, should I have a foam roller when we're giving you neck exercises to do, or the neck fulcrum or dental roll. So if those terms are new to you and you don't know what I'm talking about, then that's okay. Ask us in the office. For those of you that are already doing work on your cervical, your neck curve, and you're laying on a posture pump or the CerviGuard or the fulcrum or the dental roll, those are specific devices that help with restoring the curves and working on changing the curves of the spine itself, the neck curve. That is, nothing that those do are the same as laying on a foam roller. So I want to be super clear that this is not, oh, I need a neck curve back. I'm not going to grab that device for my neck from you guys. I'm going to lay on a roller. I don't support that. I never told you to do that. I promise you, doc never told you to do that. Don't do it and tell us you're laying on something changing your curve, because you're not. Now, laying on something just to work on the muscles of your neck, that's fine. And it's doing it, that's for a different purpose. So if you're just stretching the neck or wanting to lay on something just to create a nice posture when you're reversing kind of the stress of this of your day, right? Then something like this would be fine. So if we're not talking about restoring curves and changing ligament structure and all of those components, then we have kits like this that's 2 different sizes based on, again, the size of your neck and your width, that you could, it's much less dense foam, it's much softer. And again, whether you have a long neck or a short neck, and your width would be depending on what size you would use here, or what your body can just tolerate at that point. If something's really hard to be an extension for more than a minute or 2, then we're going to start you on something slow, which would just be doing a gentle stretch laying over this before you could work into laying on something firmer like the Deneral or the Fulcrum or the pump, which is changing the curve. So this is a good just stretch component for the neck, not a change the structure component for the neck, but also just a good way to stretch and lay and relax and decompress from the day. So I'm going to pull that one out because I have a long neck, so I would use the bigger one. And we're going to go through a few demonstrations. So would you mind flipping through for me, Michaela? As we get into the last about 5 to 7 minutes, and I'm going through them, we're going to look at a couple different muscle groups, muscle bellies, and motions. So when we're talking about the lower body, many things that we're working on is our glute group, our quads, which are the front of the leg, our hamstrings, which is the back of the leg. Those are the muscle groups that have tendons attaching to the bones on either end. So you're going to hear me talk about how far you're going to roll because of that. And you have deep layers within the glute, right? And within the hip area. Same thing, the low back, there's a lot of anatomy that's coming from your mid back down to your low back across your hip, and then down into the glutes and the legs. So there's areas of those that are great to roll through just the muscle tissue. When I get on tendon or the fascia, that's really where the rolling feels different and is working through some of that bristly adhesion that's in the fascia, that where there isn't muscle. And the big place that is the sides of the body where front and back stuff is sort of attaching to. So when you hear someone talk about their IT band, which is the iliotibial band, it's a big fascia layer that I describe like a spider web. And there's a lot of intertwined layers of fascia, and there's no muscle of that. And so we need to break up adhesions in the fascia. And when the fascia is tight, it's pulling on a lot of other things, either here, or up here, or down at the knee. So a lot of you roll, but when I see how you roll from like here to here, and you miss all of this to the top of your hip, and you miss all of this down to that like notch where you bend your knee. So if we're talking about the fascia and stretching doesn't feel like it's giving you much movement or release, then it's probably in the fascia layer, and we need to get you rolling through that IT band and different areas around these muscle groups. Go ahead and click for me, Kim. Psoas, the one you just love that we work on in the front of your hips. So there's 2 muscles, the iliopsoas, or people know them as the hip flexors, right? It is the muscles here that we dig in on you on the side of your hip and ask you to bend the leg or bend the knee and do some movement while we hold pressure around those trigger points. They are 2 muscles that run together. They are very long. They are attached on the inner brim of your pelvic bone, and think about an upside down V. They're on the insides of both the left and right hip. And then they dive underneath your abdominals, muscles, all of your intestines, and attach on the belly side of your spine. So for those of you that ever have a condition or ever have a situation where you feel like this, or you try to get up from somewhere and you feel like you're walking like an older person and like you can't stand up straight until you work things out, you will 99% of the time tell us, I feel it here. I feel tight or pain back here. And if you can't stand up straight, or if you're tipped like this, it's the hip flexors staying tight and not releasing, allowing you to tuck your belly button in or tuck your tailbone back underneath you and stand straight or neutral. So that does a lot of tipping and tilting here. And we feel it in the back, but it many, many times is coming from the front being tight and or just imbalanced left to right side. So the diagrams give a great visual, if you're a visual person, as to where those muscles attach. But some of them are in the deeper layers underneath all this stuff that we can't get to. So we can reach the lower, you can reach the lower with the foam roller. And I'm going to show you that in a second. Men, it just has to be done different and a little bit more delicately because there's anatomy we got to be careful of, right? So for women, you can roll across the front of your pelvis and hips. For men with the anatomy there, you really have to almost do a frog leg and roll just through the inner thigh here and try to get as close as you can to that area. But it's hard, it's a hard one to do yourself. So the last one, and as we work our way up the body, is going to be the erector muscles. So the rector spinae are all of the muscles that are attaching in layers and depth out this way from your spine. So from, shoulders down to tops of the hips and bottom of the lumbars here. And there's layers of them. There's 3 layers out, and some of them are thicker and some of them are thinner. And they all are attaching to the spine and all those attaching muscles out into the shoulder blades and down into the hips. So I love using this vertically and horizontally on that, on those erector muscles to get places in that mid back and even some of the low back, but mid back and shoulder blades that you just can't stretch yourself, and that you can't really hit those trigger points without either the massage therapist's hands or a partner's hands, or even, to me, a tennis ball or lacrosse ball is too intense in some of those areas. So if you have an injured area or an area that's just too intense to lay on a ball, the roller just lets you distribute the weight of you over a bigger area, and then it doesn't feel so intense like a tennis ball does. But again, tennis ball, lacrosse ball could work really well to get into small areas too. They're just not what you would lay your whole body weight on. This you can. So maybe leaning against a wall, I'd give you a tennis ball to work on triggers, but with rolling, this is going to cover more ground, more area in a less intense way. The last group of muscles, and then we're going to get on the floor and demonstrate, is the suboccipitals. The suboccipital muscles are 4 small muscles. You've got the ones on the left of the center of the spine and on the right, and they're attaching. You have them some in the neck, but the suboccipitals are right up in where the skull meets that first vertebra. So right where head meets the neck. And those little muscles are those postural muscles holding your head up all day long. And we all know how much they work and how tender that can get back there through those areas when we're like this all day, or we're on our phones a good chunk of the day. And if we're not doing it here at our eye level, right? And if our monitor is down like this and not up here. So those muscles work well over time, as well as they over engage these. So the stretches and exercise we give you to do are to stretch those, but sometimes there's trigger points that develop in that part of the neck, and using certain tools like this can help just release those. So the last 5 minutes here is really me going to be able to demonstrate about 10 different things for you so you can see how to start, and then again, take it from there. And if there's a question, ask us, we'll show you in the office, or we can demonstrate together once you've watched this. Or if it's an area where you're like, okay, I feel like I can do more than that. I've been doing that one. Is there anything different I can do? So we're going to cover the basics with a few ones that probably weren't in the other workshop with the different tools. So Maggie's going to kind of just aim this more towards the floor, which I don't know if you have to back up. I'll let you be in charge of it. So when I'm doing the neck area, again, if I was just wanting to stretch my neck and lay on something supportive, but not too firm. The idea of something like this would be good for someone with a shorter neck. I have such a long neck that this doesn't feel like anything because I just have more flexibility than this. But if someone's starting off, they've never used anything under their neck, and they've had neck trauma, injury, I would start them on something super soft like this. And again, if you were smaller than me, we would use a smaller diameter. This is just for stretching and laying over, almost like rolling up a towel. If we are more advanced or have a neck that's long like mine, and I'm just trying to roll or put some triggers on those occipital muscles under my skull, then I would take a smaller roller like this than the big ones, and I would just let my head rest over them and get those trigger points that are right under the skull. Or when that's comfortable enough for you, like it is for me, I will just literally roll to my side and back. And that gets all these muscles that attach right here that we poke on and stretch for you guys when you're in here. And that helps loosen some of those trigger points. But I'm not hanging out on a roller. I'm just rolling over it and moving on. So same thing, I might roll the other side and go all the way to my side and then come back this way. And it just feels great. It's just the weight of my head is all that's on there. So those help get some of these ones in here that are hard to get, that you can't really get into with your own hands, to just over a handful of seconds, back and forth, back and forth. Now, some people have more of a method of starting at one end and rolling down and then going back and starting and rolling down. I tend to just go and do 2 to 3 passes each direction and move on. So to move on to the back, you can set the roller against, mostly this is for rib cage. I'm going to put the foam roller right at where my ribs start in my mid back and just roll myself all the way to the top and then back down. I'm just lifting my bum off the floor a little bit to roll back through that rib cage. You can change your arm position and you can get things between the shoulder blades. So you just have to work with where you are and what your body can tolerate and what it needs. You don't have to do any arms at all. Now, I don't put any kind of weight on my low back because there's much less muscle and tissue. So I just literally do a pass up, down, and I'm done. So if I was doing low back, that's a little bit more specific and you're not putting your body weight down on the roller nearly as much. So again, if upper body doesn't bother you, I would support more of my weight into my hands and my shoulder. And I'd actually go this way with it, but resting the low back on it, you can do some very nice low back rolling, but my weight's in my legs and my hands. It is not on, like all the rolling is not happening on my low back. And again, I go back and forth a handful of times. Now, once you get to your glutes, we all have a lot more meat and muscle here and a lot of fascia attaching here. So you can sit on the roller or certainly put much more weight usually into the roller. So I always do all angles. So when I'm doing the low back, the glutes, right? So into our buttocks, I would tilt and I would roll from the top of the back of the hip there. And then I would turn my angle so that I'm getting that deep fascia and the crossing layers between the 3 glute muscles. So from here through here. Then if I'm just doing my hamstrings, to me, it's more about, I change the angle of my toes. So if I'm doing the back of the legs, I just do them at the same time. Again, I'm all actually about efficiency and being on this thing less. So if my first pass, I do all the way across the back of the leg, the knee, all the way to my ankle. And I'm just scooting myself down. Then I change the angle of my toes. So I point my toes out and get more of the outside of my calf, the outside of my knee, the outside of my hamstrings in the back of the leg. Then I change and point my toes in. And again, get more of their inner thigh on the back, inner hamstring, that inner part of your knee, and it's just the weight of my legs, inner part of your calf and your gastroc muscle, all the way down to your Achilles. So I think, again, it's worth getting all the way to the tendon, all the way back up to where things attach at your sit bone, like literally the part you're sitting on under your tush. When I'm doing the spine, it's long ways. So if I was doing all those muscles attaching in my shoulders, I would do it perpendicular, right? Now I'm going to be parallel and I'm going to sit on one end and I'm going to rest on my head on the other end. I would have your knees bent and your legs, your feet flat, just like you do when you're on our table or you're doing your general or your fulcrum. so that my back is, hopefully you can tell with what I'm wearing, more flush against the roller. And I don't have a bunch of pressure points in any one spot. So this is not tender at all to me on my back or my shoulder blades or my low back, because the weight's more distributed evenly. So then this is where you're rolling left and right. So I'm rolling towards you and away from you, and getting more of all those postural muscles and ligaments and tendons that run and attach on each side of the spine, all the way top to bottom. What I love about using it this way is you get a lot of area, and you get a lot of muscles that you never stretch the same way, and you can't reach with your hands, and you're not holding your body up. My worst pet peeve is when someone's doing an exercise, but they're doing it in a way that they're like this and they're straining their neck, or they're holding themselves up like this so they could try to do something down here. I'm gonna hopefully never give you something that you feel like you're stressing another area in order to do something else. So when we give people low back suffer low back or abdomen or the pelvic floor, it's never this kind of stuff. It would be things where you're doing movements, bringing the legs to you, or a different type of motion. So when you're laying on this, there should be stress nowhere, and you shouldn't be feeling like you have to hold yourself up. If you're trying to do that on a short one, you're holding something up while you're on a little guy like that. So that's why I just think this is so much more valuable, because you can cover more ground and not feel like you're also trying to support your body weight off of it. You could just relax on it, literally. So I go side to side, left to right, 3-4 times each side, and I've covered tons of ground on that upper back, mid back, low back. IT band, that fascia layer where we have the most of it in one spot, is the side of our legs. So this is the one that I feel like can be really tender. People don't want to do it because it's uncomfortable, but if you're there for a handful of seconds and you do it frequent enough, those trigger points relax and those adhesions let go, and it's tolerable. So this one is, again, one you're going to do from your side, and you're not going to put all your body weight on it when you're up here. But most of my weight's up here on my upper back or upper body and shoulder. So I'm going to bring it under my hip. My bottom leg is straight. My top leg, I just bend and put to support in front of me. So it's just to kind of keep me from rolling or moving the wrong way and stabilize. And then I'm coming all the way to the top of my hip. So I want you starting where you put your hands, right here on top of your hip. And then you're going to just move through the motion. So that feels fine. That's talkative. This is talkative. That isn't. All the way down to that notch on my knee. Just right past where your knee bends. And then you're going to come back up. And you don't hang out on a spot and torture yourself. You literally go back and forth. And the more you do that, the less those tender spots are. So you can do different slight angles, but that's how you roll the IT band. Then I would flip and do the other side. When I'm doing the front of my body, so that hip flexor, right, that psoas muscle, we can reach some of it right through here. So for women, the easiest way to do it, I think, and again, shortest amount of time, and again, there's not one way to only do this, but the way I do it is to get the quads, your front of the hip leg, and your hip flexor at the same time, and be done. So I start up at the belly button, and that's where I set my weight. And again, most of my weight's on my elbows. And then you can just have your legs flat, or like I do, come up on my toes, lift my knees off, and just, again, sort of army crawl. So I'm going to roll across my pelvic bone, just slow and easy, and then through my quads. Now we're stopping here. We're never hitting the kneecap. That will hurt. And then coming back down. You can choose to put one leg down and one leg out in kind of what I call a frog leg, and roll at that angle here and get a little bit more of that pelvic bone and your inner thigh. And again, there's different ways to angle this, but I want to just keep it simple of like where to start. I would just start here, and again, roll from belly button to right above your knee. And again, like I did when I was doing the back of my leg, I pointed my toes up I point my toes out, and then I point my toes in. And when you do those, then you're able to get the different angles of the inner, the top, and the outer quad muscles. So we did not go into shoulder, but I'm going to show you the chirp wheel last. And this is, again, if you just want to see what it's like, it is bridging my spine, which maybe what I'll do is go this way so you can. I rest it up against my back, lift on up, and roll. And it is literally going along my spine. And it's super comfortable to put all my weight on it. No problem for me. And I've used this thing a long time when I've had back issues and when I haven't. If you are dealing with rotator cuff, shoulder stuff, motion that you just can't do through here, and it's bothering the neck, or it's creating a lot of trigger points in your shoulder blades, many times it's some of the rotator cuff muscles that are in your armpit. So the one we're going to end on, and I appreciate you hanging with us for us starting late and going a little bit more to try to show you more things, is that if you can take a foam roller into the armpit, which again isn't as very pleasant and can feel like it does when you're on the front of the hip, if you do it frequently, it does not stay that uncomfortable. But it tends to be some of either the infraspinatus or teres muscle that is deeper in here, that's creating the pec to be tight, or some of that, the rhomboids and the areas between the shoulder blades to be tight. So if we're talking about rotator cuff muscles with you and asking you to roll your armpit, this is what I do. This is what it looks like. So I, again, stay all my body weight on my side. I rest my armpit almost on it, and more of my body weight's here than on the roller. And it's an awkward kind of motion, but I'm just rolling my armpit, my back of my arm through my armpit. It's a small motion. It's just this. It's tender. It's not super comfortable, but it's not pain. And it's getting all the attachments of things all along here. When you need to counter it, it's the pec muscle here in the front of the armpit. So I would just do the exact same thing and just lean a little bit more forward. And it's that, I mean, that's as far as I need to go. And then I'm getting all of this right here. So if you can roll here, you see me do 3-4 times, that's it. 3-4 times, that's it. Don't hang out on anything for long. Just pass by and do a few at a time. Go to the other side and test the other side. And that's it. So that's how you can do all the major muscle groups in the body, big ones, and how you can do some of the small ones that are intricate in your posture and see where things are talking. Because one thing that we're constantly enforcing besides mobility is that the symmetry is there. So if someone is having one-sided issues, they most likely have the other side or another component of the body being over tight or compensation happening. So even if you're only feeling stuff on the right side of your body, roll the left and the right. Because we've got to know, do we feel things in different places that are there that you didn't know were there? And you'll be surprised what you find. So I'd rather you say, oh, I rolled both sides and they both felt the same. Awesome. That is probably 5% of people that come in here. They tell me, oh, that feels great. At least unless they've been doing it a long time, then they are more symmetrical because they've been at it longer. But most likely you're going to find things that are asymmetrical, and then that's how we can help support you with different things to do, or maybe different ways to roll, or a different exercise or activity to incorporate. So we covered a lot in this one with just trying to explain the what's, the tools that people ask me about that are confusing to them, and what I use the most and where I use it to start out. So come in with your questions. We can demonstrate and show you if you've tried it and it doesn't feel right or doesn't make sense. But at least you have this recording after today to go back to and reference. Then we could talk you through more details or more advanced level of rolling, or just another area that we didn't get to cover. So have fun with rolling. I would say, don't be intimidated by it. I would say if you're concerned about an injury or something you can and can't do, then of course, let's talk about that first and then decide what you're ready to do. If you need a roller, let the girls know at the front desk and we can make sure we can get you one if you don't want to go order one or buy one in a store. We're here to support you there too. So thanks for joining us tonight. Thanks for those of you that hung out a little later, and hopefully you got some benefit from this, and we're excited to hear your takeaways when you're in the office later this week or after the 4th of July. See you soon.